Over the past 30 years, the number of women giving birth to their first child over the age of 35, in the United Kingdom, has increased significantly. Although many women are now choosing to delay motherhood for a variety of reasons, experts argue all women who are trying to conceive later in life should be aware of the menopause and how to identify symptoms of perimenopause, the 2 to 10 years before periods stop completely. The menopause can be defined as the stage in a woman's life where menstruation ceases, and the ability to bear children stops. The menopause is a natural part of the female aging process which usually occurs between the ages of 45 and 55 years, as a woman's estrogen levels decline. In the UK, the average age for a woman to reach the menopause is 51. Dr. Manuel Munoz, fertility expert and director of IVI FertilityAlicante, seeks to provide some insight on the topic of fertility before, during and post-menopause. Age-related infertility is not just a problem upon starting the menopause. Dr. Munoz said, women are born with 1 to 2 million eggs, all the eggs that they will ever produce. The quantity of eggs decreases by the hundreds every month, and upon reaching the menopause only about 100 eggs remain. The declining number and quality of these eggs, as well as age-related uterine changes, contribute to reduced fertility. This occurs before menopause, and even before the signs of perimenopause are noticeable. At IVI we run tests that can indicate that you are entering perimenopause. Following this, there are some specific treatments available to you and your partner. After the menopause has begun, chances of conceiving naturally decreases. Dr. Munoz said for women below the age of 35, there is around a 25% chance of becoming pregnant during sex when the woman is ovulating. He added, however, beyond this age reproductive potential decreases, and after the age of 40 when the menopause commonly begins, the chances of becoming pregnant are less than 10% each month. Age is often the single most important factor when it comes to getting pregnant, and although pregnancy is possible until menopause is confirmed by 12 consecutive months of no periods, this is a rare occurrence. After the menopause has occurred, pregnancy won't happen naturally. The only way a woman can get pregnant is through a donor egg and IVF. People can experience the menopause prematurely, although the majority of women experience the menopause during the usual ages of 45 to 55. Around 1 in every 100 women experience the menopause before 40 years of age. Dr. Munoz said, this is known as premature menopause or premature ovarian insufficiency. It can even begin before a woman notices any symptoms or has reason to think she may have trouble getting pregnant. The symptoms of premature menopause are very much the same as natural menopause: irregular or missed periods, periods that are heavier or lighter than usual, or hot flashes. There is no obvious medical cause of premature menopause. However, it has been linked to genetics, lifestyle factors, such as smoking and BMI, and autoimmune diseases. At IVI we run a series of tests to find out why the couple are struggling to conceive and to help us decide the best course of treatment for each patient. This includes checking the female patient's ovarian reserve through a blood analysis on their third day of menstruation, and as the second stage we would then carry out an ultrasound. During the ultrasound we will count the number of follicles to check whether the patient has a good level of oocytes, an immature egg cell. This test gives us a better idea of whether the problem is related to aging, and if that's the case, it's always better to find out early rather than later, when your options become much more limited. People can have fertility treatment after the menopause. Dr. Munoz said more women are making the decision to try for a baby later in life. However, the chance of becoming pregnant decreases the older you get, he added. In cases like this, we recommend egg freezing at no later than 38 years of age. This age limit ensures that there is the highest chance the eggs will thaw successfully. These eggs can then be used by a woman if they would like to try for a baby after going through the menopause. However, it is vital that women consider the psychological and social impacts of egg freezing, and make sure that they aren't rushing into a decision. Dr. Munoz also recommended egg donation, which involves fertilizing an egg from another woman with a partner's sperm. This fertilized egg is then implanted into your uterus, he said. It is worth noting, if a woman would like to get pregnant post-menopause, it is likely they will also need to undergo hormone treatments to prepare the uterus to receive an embryo. At IVI we aim to provide women with accurate, evidence-based information about their fertility to enable them to make informed decisions around planning their family, and we also need to ensure that our maternity services are equipped to provide the additional care that some older mothers may require. There is no legal limit on a couple trying for a baby post-menopause, Dr. Munoz said. There is no legal limit that prevents a couple from trying to have a baby. It depends a lot on the circumstances of each couple, on their health and physical condition, and also on other factors. For women, the age of 50 is a reasonable limit beyond which fertility treatment is not recommended. This comes after it was revealed condition can cause infertility and hair loss. But what is polycystic ovary syndrome? Watch more videos at video.5la.net.